All right, so you're here. Just in case you forgot what you signed up for, this is our Creating Caring Communities series. And this is a series that we're doing in which we invite different speakers who are doing amazing community work, helping to support children and families to thrive and learning from them. We had an event last spring with Darsha Narvaez, and about the kinship worldview, which was just wonderful. And so we're so happy to continue this series with Sharon Hirsch, the CEO and president of Positive Childhood Alliance in North Carolina, and Carey Sipp helping us facilitate. So welcome everyone. This is Nurturing Positive Childhoods, which we'll get into. So we're going to do a regulation activity. I'm going to talk a little bit about what we do at 10 Collective. I'm going to turn the conversation over to Sharon and Carey, and then we'll take questions from all of you. So this is one that I learned from a favorite person of Carey and I's, Elaine Miller-Caras. And this is when we're feeling really dysregulated in the body and we focus on somewhere that it feels strong. And the reason I picked this one is because I just went on this 11-mile hike up a mountain that was so hard. And every time I wanted to focus on how bad my legs hurt, what I did was I used this tip from Elaine Miller-Caras, and instead I picked a body part that felt strong and focused on that. And that worked really well. So if you don't mind joining me, you can, whatever helps you feel centered and present, you could close your eyes if you want. And you could actually start by feeling if there's any place in your body that feels uncomfortable, feels some discomfort, and see what that feels like. And just notice it. And of course, when we're feeling really triggered and our lid is flipped, it can be hard to be super mindful, but when we practice, then that tool is more ready at hand when we need it. And then you can just find somewhere in your body that feels really strong and good. And bring your attention there and just notice how strong you are. And you can just notice that for a few breaths. Great. Thanks everyone. That felt great. I was like, wow, I should really use my own tools. If anyone had a certain response or reaction to that activity, I would love to hear in the chat how that felt. Please share. So, okay, let's get through this. So, I just wanted to kind of give you a little overview of 10 Collective before we jump into this great conversation. So you can visit our website to learn more about us. We have this great free tool, the Employee Wellness Self-Assessment. So 10 Collective, Bree and I created this together with a couple of other, we're a collection of consultants. And we all worked in family serving organizations for our career. And what we kept seeing is that these family and child serving organizations were putting trauma-informed principles in place to serve the families, but they weren't always using the same principles to serve the employees. And we thought there's really a missing piece here, and we would like to be a part of the solution. So we help teams, especially those in social services, to put these same principles in action in the workplace so that employees feel psychologically safe. And we're helping to create caring workplaces where people stay a long time and they're happy and they don't get burned out as quickly. So if that's something that you think we could help with, please let me know. You can take our assessment tool. We have a couple things upcoming, and I'll be sure to put links in the chat. I have the job grief support group that's starting tomorrow. You can check that out on our website when you click events. That is no cost. It's weekly for 8 weeks. Next week, we have Danielle talking about empowering family healers. So we hope you'll join for that. Again, I'll put the registration link in the chat. Yeah, please join us. This is our Caring Workplace series. Every week, you can tune in on LinkedIn Live to me and Bree, and we're doing trauma-informed care news for the week. So that's super fun. Um, and so ways that we can help is we can do an assessment, see where you're at. We can do training. We can do one-on-one coaching with leaders. These are some of the ways that we could help your workplace become trauma informed from the inside out. So we want to help you have less turnover, less sick days, more productive employees, and employees that are using the part of their brain that's activated when we feel safe. So this is a list of all of the services that we offer. And again, you can go to 10-collective.com and we have a detailed summary of all these things that we can offer. So let us know. I'd like to introduce Carey Sipp first. So Carey is a solutions journalist, community builder, and public health consultant who has applied the science of adverse childhood experiences, ACEs, to her work for almost 15 years, and the science of positive childhood experiences for the last 4. And Carey and I worked together at Pace's Connection for 3 years. You were there a lot longer. 2018 to 2023. And this was great. This was a networking, a big social network to advance the science of ACEs in communities all over the world. And so Carey's also the author of a really amazing book on childhood trauma. You don't promote your book enough, Carey. She launched the Trauma Informed Health Educator and Researchers Collaborative to help infuse PACE's science into medical school curricula. So, Carey, I am so grateful that you're here to facilitate this. Carey is based in North Carolina, and so she is going to lead the discussion today with Sharon. Oh, sorry.
There we go.
Okay.
Now we're all unmuted. Okay, great. Thanks. I put the title of the book in the chat and it's on Amazon. And I would say you can buy the Turnaround Mom, get the little version, the one that's burgundy and cream colored, that has a picture of me standing in front of like a 1950s Chevrolet, and buy it used because I quit getting any money for it like almost as soon as it came out. But so I have the pleasure of introducing my friend Sharon Hirsch. And I said to Allison and Sharon, this is so cool because they're 2 of my favorite humans, because I just love what Sharon does. So Sharon serves as the president and CEO of Positive Childhood Alliance North Carolina. This is important. It used to be Prevent Child Abuse North Carolina, but they figured out how they could keep the same initials, but flip it to have a request to the community instead of preventing child abuse. Let's create positive childhoods and create a whole alliance that's going to work toward this. So the CEO of Positive Childhood Alliance North Carolina, where she leads a team that works alongside her partners and the families and the communities across this great, big, huge state of North Carolina by challenging the status quo and how we support families and children. And Sharon does challenge the status quo. She is an upstreamist. I join her in being an upstreamist because we both are big fans of Dan Heath's book, Upstream, which I was just listening to again, Sharon. Thank you, because you introduced me to that book and some others that I love. Sharon has more than 30 years experience in nonprofit and government agency management, public relations, advocacy, and child well-being at Positive Childhood Alliance North Carolina. She has led efforts to catalyze community prevention plans, and she's increased staff capacity. She has a staff of 28 people. That's amazing to me.
Now 32.
32? Okay.
32.
Wow, one of these days we might even work together, Sharon.
That's right.
Has secured, well, we already do in many ways,
Yeah.
but it's secured more than $1 million in new investments in primary prevention programming. She was recently named one of Triangle businesses, and Triangle is in North Carolina. We have this research triangle of Durham, Raleigh, and Chapel Hill. 25 Women in Business Award recipients for 2024, which was a real big deal. And I got to be with her. We had lunch the day before she was going to get that award. And then I saw her via Zoom get another really cool award this last summer. And we'll get to that in just a minute, because I think that's such a wonderful, wonderful award for all about the science of the positive, something that we both love. But tell us, for people who live in a state where there is Prevent Child Abuse, a chapter, because Prevent Child Abuse America is like, what, 52 years old and has chapters in, I think, between 40 and 50 states, almost every state.
I think it's 48 now.
Oh, that's so great, because we love Prevent Child Abuse America, Melissa Merrick, and the people who do such great work there. But you've really been a game changer, shifting the emphasis away from the prevention to the positive. So what prompted the name change from Prevent Child Abuse to Positive Childhood Alliance? And that happened back in March, I think. And what's happened with that so far?
Well, lots of things prompted it. We for years really have struggled with people not understanding what we do. They'd hear prevent child abuse and they'd think that we worked in the child welfare system, that we were working with foster care, and we don't. We're focused very much upstream on preventing it from ever happening in the first place. We also had a great deal of trouble, frankly, in getting corporate sponsors, corporate support, because many companies would tell us, we love what you do, but we can't associate our brand with child abuse. And again, I would say, we're not talking about child abuse. I see some friends on here. We've probably never talked about child abuse itself. When we talk to one another, we talk about the things that families and children need so that kids can thrive and families can feel safe and whole and well. And then we also found that families did not see themselves in our work. When they heard our name, they thought that was about other people. That's about other families. That's not about us. And we really wanted to flip flip the narrative completely and focus on what we want to see instead of what we're trying to stop. And when we talk about positive childhoods, everyone wants positive childhoods for their kids. People can see themselves in that. Corporations want to get behind this because we need all sectors to be a part of this work. And we've also been working with our friends at Prevent Child Abuse America and have released a new theory of change for creating a primary prevention ecosystem in our country. And we can put the link to that in the chat for anybody who hasn't seen it. We're developing our strategic plan based on that theory of change. And when you look at it, you'll notice that the words child abuse and neglect are not in the theory of change. It's focused, the North Star is that all children and families are living a purposeful and happy life with hope for the future. And our aspirations are all about things like financial stability and economic mobility, mental and physical health and well-being across the lifespan, access to formal and informal supports, and loving and secure family relationships supported by foundational life skills. These are all things that people want for their families. And all of this is focused on positive childhoods for all children. So we never mention child abuse and neglect in that theory of change. And so the idea of still calling ourselves Prevent Child Abuse has been it's been a barrier for us in a lot of spaces, and we felt like this was the time. We're celebrating, as you can see on my screen, our 45th anniversary this year, and just felt like this was finally the right time to do this. I've been, for lack of a better word, overwhelmed by how positive the response has been. Nobody has said, why in the world did you do that? People have said, oh, wow, that's brilliant. Oh, that's so smart. That makes so much sense. And so we've just been learning and growing as we've begun to implement this and to think differently about the messages that we put out in the world. It is very rare that you'll see anything in our social media from this point forward that focuses on child maltreatment. We're going to be always focusing on what we want to see for kids and families and how do we build positive childhood experiences for all of our kids. And that's always what we've done. We're just reframing the way we're talking about it.
Yeah, and I love that, because we know from the science that we can buffer the adverse childhood experiences with the positive childhood experiences. And the more of those that we can create, the better. So how are you doing that? How are you focusing on these and helping create positive childhood experiences for North Carolina? And let me say, as North Carolina goes, I'm hoping so goes the nation, because this is such a great shift. We can't deny the abuse and we can't deny wanting to, but over time, a generation or two, this is going to help shift it so much. So what are y'all doing to help bring more positive experiences?
Well, a couple things. Let me start by saying I want to address what you just said about positive childhood experiences buffering adverse experiences. We're now trained in the HOPE framework, and we're going to be start training in that. And one of the things that has taught us, and this was a real eye-opener even for me, it just reinforced the name change, is that the absence of positive childhood experiences, the research now shows actually has a far greater negative impact on long-term health and well-being than the presence of ACEs. So we've got to focus on making more positive experiences possible for kids.
Will you say that one more time? Because that is just so profound.
It's so profound that the
Mhm.
absence of positive childhood experiences has a bigger long-term negative impact on health and well-being than the presence of ACEs. So we need positive experiences. And one of the first ways we started talking about that here at PCA was that we sent a team last summer and again this summer to the Montana Institute to learn from Jeff Lincolnbach and his team on the science of the positive. And it's a life-changing experience to really get steeped in that for a full week. And it has challenged us in lots of different ways to think about how we talk about our work and how we frame the things that we're already doing that are already promoting positive childhood experiences. We've been doing that for a very long time. We just hadn't called it that. So we do things like support evidence-based programs, parenting and family support programs. And making sure that they get implemented well. We provide implementation support for them. We provide a lot of training and technical assistance. Almost everything that we do is really focused not on kids and families, but on the professionals all across the state that are working directly with kids and families and building their capacity and their ability to create positive childhood experiences. So we do training on things like the protective factors framework, on connections matter, now on the HOPE framework, community resilience model, really steeping our professionals. We were in a meeting this morning with Ivana, who's on here. And one of the things I was telling my subgroup was that we recently had a training in the protective factors and connections matter for one of our county departments of social services in one of our large urban counties. And it was a team of folks in their child welfare section, and only one of them had ever heard of ACEs before. And it's mind-blowing because we all talk about this stuff every single day. And there are still a lot of people that don't, and a lot of people that are working directly with children and families in our school systems and in our children and family serving agencies still aren't talking about adverse experiences, much less positive childhood experiences. So we still have a big mountain to climb in terms of educating folks and making sure that we're focusing on the right things. And then the other two big pieces of work are around raising awareness and educating both the general public, but this population of folks in child serving organizations about what works to keep kids healthy and safe and to promote that and to provide them with training and toolkits for folks to help them spread the message in their own communities. And then we advocate for policies that we know create more positive experiences. And one of the things Jeff Lincolnbach has taught us so well is that we know that the positive and negative are always with us in our society, but especially in the United States right now, the negative is really, really loud. It's really, really loud. And so spreading those positive experiences, information and focusing on what we want to see instead of what we're trying to stop is an incredibly powerful countercultural message to send.
Just
And
like
so
the regulation activity we did to start, you
yes.
can apply that to bigger, widening circles of things that we focus on. Yeah.
And so the policies that we want to support for things like that are things like paid family and medical leave, because parents need to be supported from the start, and it fosters nurturing and attachment, those connections that are so critical for baby's brain development. Making sure parents have positive experiences. So that means that they've got the financial means to support their families. And so we're focused on financial stability and economic mobility policies like earned income tax credits and living wages, SNAP benefits. We're so excited here in North Carolina that we finally have Medicaid expansion and more families now have access to medical care. All of those things are correlated with reductions in child maltreatment and positive experiences for parents. And then we think about wanting to see more parenting and family support programs across our state. We have a network of family resource centers that are very, very under-resourced. So we advocate for more investments through those agencies that are supporting direct services to families to keep them out of that child welfare system in the first place.
Well, that is so important. And you know, because I was at the Montana Institute this summer, I attended virtually, but got to see you there. And one thing that Dr. Jeff Linkenbach, who is called the father of positivity, and he was one of the authors with Christina Bethel and Bob Sege and Jennifer Jones and Bart Klika and Christina Bethel, of the positive childhood experiences report that came out in 2019 that lists the 7 positive childhood experiences that people who, if you have these, you are less likely to have mental health challenges as an adult. But tell us a little bit more about what you learned there at the Montana Institute, because it really is, Allison, just like you were saying, focus on what's positive in your body. How does that relate, Sharon?
Well, so much of what we talk about in our work, then this is a gathering of folks that are really in public health. And when we focus on a lot of things prevention-wise, we're always focusing on what we don't want to see. And a lot of the examples that they were able to share with us were examples of things like in preventing opioid crisis or preventing kids from drinking or smoking pot, that when we have these big campaigns, we tend to share images of what we don't want to see. We share images of people using drugs. We share images of kids binge drinking. We share the exact opposite of what we want. And what they've really taught us was that we need to dig in deeper and find out what the norm really and truly is. That often when we're talking about wanting to change things, we're making the assumption that more people are doing the thing that we don't want to have happen than actually are. For example, they found that, if I may be misquoting the exact number, but it's in this ballpark, that only 15% of college-age students were binge drinking every week. But kids thought everybody was drinking Thursday through Sunday, right? And when you can flip that script and say 85% of college students don't binge drink, and are finding other ways to have fun on the weekends, that completely flips what we think is normal and what everyone else is doing when we're trying to change norms. So we're trying to think about things like that to help us imagine what families need. And even with our Essentials for Childhood work, talking about things like, people assume that all the other parents in my neighborhood actually spank their kids, but I don't spank my kids. But if we actually did a survey, we'd find out most people aren't spanking their children anymore, and then just flip that conversation to most parents are using positive parenting techniques to discipline their children.
I love
helps
that.
to
Love
change
that.
the way we talk about things and normalize what we want to see.
Right. So Sharon, one thing that you did that I love so much is you look at, and I know we've got to have business as our buddies, right?
Hmm.
But with your dear friend and my friend, whom I absolutely adore, Claire Anderson out of Chapin Hall, was you looked at ways that business practices actually facilitate child abuse and neglect. But we could also look at ways that business practices like the ones you just talked about, and there are other ones, could actually help not only prevent child abuse and neglect, but help create more positive childhood experiences. And I know you've spoken on this. So would you talk about how the workplace is affecting positive and adverse childhood experiences, and what we need to do to empower Allison and Bree and others at Tend to go into businesses and say, look, guys, you could have a huge impact if you would only do what Sharon says.
Well, if
what is
everybody did what Sharon says, that would be amazing. But, you know, the way I always look at that when we're talking to businesses to say that every single employee that you have is a member of a family, whether they have brothers and sisters and parents, or they have children of their own, everybody is a member of a family, and we all struggle with work-life balance. And we know that when we look at the downstream consequences of adverse childhood experiences, we know just with abuse and neglect that the downstream consequences are costing North Carolina well in excess of $2 billion every year. That we've put some social math on that, and we now know that that's $4,000 every single minute that we're spending on our healthcare system, our criminal justice system, juvenile justice, all the bad systems that we don't want to be a part of. But the biggest chunk of that expense is in lost worker productivity. So we've got folks in the workplace who have experienced trauma and adversity in childhood that's never been addressed. And if we could talk about it and create policies and practices in the workplace that create positive experience for parents, their kids are going to be better off. So parents that are making enough money, first and foremost, are going to be better off. Parents that have more flexibility to pick up their kids from school, to have support for paying for childcare and after school care, and who have paid family and medical leave, are going to have more positive experiences that they then share with their children, because we know that the overload of that economic stress is one of the leading causes for child maltreatment, especially for families with young babies. In North Carolina, there's been a study done on what could happen if we had 12 weeks of paid family and medical leave, and we could save 26 infants' lives. And that's often shaken baby. And that's parents who don't know how to handle a really upset infant, and who are also overwhelmed themselves by the things that are going on in their lives. It's really easy for people to just say, that must be a horrible parent. How in the world could that happen? But if you go back and say, why did this happen? It's usually an overload of stress. And if we can be doing more to reduce that overload and be promoting good, positive experiences in the workplace, you're going to have more productive employees right now and into the future. Your future workforce is a part of what you're doing to invest in your workforce today.
Right. And it's so amazing to me. I moved here from Atlanta, where there, the Resilient Georgia whole premise behind it was getting soft skills into the schools to create for workforce development. And that's how they got a lot behind Resilient Georgia. But here, you've done such a great job of even tying the stressful time before paychecks to the increase of child abuse and violence. And I just love that you've done that, so that businesses can see what a role they can play, because we've got $7.25 as our minimum wage, which it's been since 2009. But another big factor is childcare. And that's been a real huge controversial issue in North Carolina, and it is everywhere. And that's why it's an issue in the presidential campaign as well. But would you want to talk a little bit about what happened with North Carolina having a child care workers walkout, and if Prevent Child Abuse or Positive Childhood Alliance, were y'all in support of legislation to increase the funding for better pay for child care workers?
We are absolutely in favor of anything that strengthens the child care system. For those of you that aren't in North Carolina, we have a huge crisis here, and our legislature hasn't really addressed it. They have put a Band-Aid on it this year. They've only provided funding for half the year, and our legislature did not approve a budget this year. Here we are, it's September 17th, and our fiscal year started July 1st, and they have still not approved a budget for this fiscal year. So it's a very, very big crisis. We also know that child care providers are still, on average, making well less than $15 an hour, which still really isn't a living wage. And so we've had a terrible time with turnover in our child care system, and we've seen more and more child care centers been closing since the pandemic. The business model is not working. There needs to be more support. There are a couple of proposals on the table, and there is an effort right now that's being administered through the North Carolina Partnership for Children, or our Smart Start network, for something called TriShare, where employers pay a third, the government pays a third, and parents pay a third of childcare costs. But it's still just a pilot, and I believe it's only in 3 counties being piloted this year. But it's promising. It's an opportunity for businesses in those communities to be putting some skin in the game for childcare, because it's in their best interest to both recruit and retain a trained and qualified workforce. But we all know, I mean, I'm guessing most of the folks that are on this call today know that we need a greater government investment in childcare. It's a public good, and it's in the best interest of all of us and all of our businesses, because that's the workforce that supports the workforce. And people cannot go to work when they have young children and families if they don't have a safe, stable, nurturing place for their kids to go when they're at work. And it's especially stressful for our youngest parents. We particularly have a big crisis in North Carolina for infant care. And one of the things that I try to remind folks is that all of these policies that we talk about are interconnected. If we had 12 weeks of paid family leave for all parents after the birth of a child, we wouldn't have nearly as much pressure on our infant care system, especially if mom can take 12 weeks and then dad can take 12 weeks, or they can mix it up. That would give them 24 weeks, 6 months of paid family leave. That would be a big deal. In North Carolina, on average, moms are going back to work 2 weeks after giving birth, which is horrible. And I can't even fathom how anybody has recovered physically to go back to work then. And the reality is that in our licensed childcare system, you cannot have a child placed in a licensed childcare setting in North Carolina until baby's 6 weeks old. So what's happening in those 4 weeks in between? Where are kids going? Who are parents relying on? We've heard stories of moms who've left babies in cars in the parking lot when they've gone to work, and something terrible has happened. That is a 100% preventable situation. And we'd have to raise awareness about it more. We know that puppies can't be separated from their mothers until they're 8 weeks old. And here we are forcing moms back to work 2 weeks after giving birth, where most organizations still to this day do not have paid leave policies, but we do have lots of progress the last 5 or 6 years. In North Carolina, our governor passed an executive order allowing paid family leave for state government employees. We have, I think now, 28 city and county governments that have passed paid family and medical leave for their employees, not in their communities, but for their employees. Our university system now has it, our court system, and our legislature all have paid family leave on the books. The biggest challenge is that we need paid family leave for our lowest wage workers, those that are working in retail operations, those that are working to clean houses, who are working to serve our food. That's who really needs paid family leave, because they're earning the lowest wages and are under the most overload of financial stress.
Right. And it's amazing because, I'm sorry, did I interrupt you, Allison? Were you going to say something? Okay. Because North Carolina and South Carolina are historically very anti-labor states, anti-labor movement states. One of our attendees wanted to know if you would repeat again the third model for the parents and the governor, and then, government, and then it's the business pays. Would you?
It's called TriShare. Okay. And there's a little bit of information on the North Carolina Partnership for Children's website. And it's a third parents, a third their employer, and a third government providing financial support for subsidized childcare. Okay.
And that's just so critical. And I don't know, I think I might have mentioned this to you, but this book that I love that you can't see because I've got my screen on on Blur so that people can't see that I am not the neatest person in the world. But, we've talked before, you and I have had some long-ranging conversations about the need to flourish envy, because I know you've looked at what other countries do. And this book about raising children in Denmark and how they do it there, which is exactly what you're talking about, because you're talking about the models of childcare there. And I mean, what would you love to see, Sharon? What would your laundry list be? If Sharon, we get to do it all.
If I had my magic wand, we would have paid family and medical leave for everybody, for all the ages and stages, because this is also important as we're raising our children. Children and spouses get sick and we need to take time off, and we need to be able to have the time and space to do that without fear of losing our jobs. Our parents get older. We would have childcare subsidized for everybody. Just like we have a public school system, we would have a system for childcare for everyone. We would have wages that kept pace with what it takes to support a family. So we'd have living wages for all in every location, and we would have access to healthcare no matter whether or not we were employed. Tying our healthcare system to employment is really, really challenging for lots of people, because there are lots of good reasons why we have to leave the workforce. Even when we retire, if we retire before we hit age 65 and can get into Medicare, that's a challenge for families. So wages, healthcare, childcare, and paid family leave, if we had those four things, the way we raise our children and the outcomes that we see for those kids would be dramatically different than what we've got. And we're the only first world country that doesn't have these things. Everybody else has them. You go to any European country, they have it. I think that there are only like 4 other countries in the world that don't have paid family leave. It's mind-blowing how far behind we are and how stuck we are in the way we've always done it, and focused on paying people the least amount to do the most work. Yeah. We've got it, as one of my former colleagues would say, bass backwards.
And I would, yes, and Cassandra says that in her state, and I don't know where you are, Cassandra, I don't remember where you are, but the business about subsidized breakfasts and lunches, which we love that. Yes. Tim Walls in Minnesota, the thing that I say, sad mamas, so mamas who are sad from work because they are so stressed, have sad babies, and sad babies grow into being sad children who go to school and their brains might as well be in a baggie because they can't focus. But also if they go to school and they're hungry. And so that Tim Walls said, a child can't learn with an empty stomach. And so, because Cassandra, right. You that your state has breakfast and lunch for all kids in Minnesota? Yeah, of course it's in Minnesota, because Minnesota does the deal. Land of
but Carey, there are places in North Carolina that have moved in that direction. Durham and Wake County, for example, have universal breakfast and lunch in the public schools now. But the challenge in a state like ours is that we have great disparities from county to county. We have 100 counties in North Carolina. The funding that's available to counties is based on population and the tax base at that local level. And so our small rural counties cannot compete and provide the same level of benefits that a Durham or a Wake can do. There's the same thing around childcare. Durham has universal pre-K available to anybody at 4 years old. Well, Durham has it, Mecklenburg has it, and that's the Charlotte metro area, another very wealthy area of the state. But a county like Watauga or Vance or Cherokee does not have the resources to provide that kind of support for families. And that's why we need some state level solutions and some national solutions.
Right, because the disparity in the tax bases, where you've got those rich areas versus the poor rural areas where you don't have those big income generators like the tech industry that you have in the Triangle, that creates such a great tax base to help pay for all of that. Well, so y'all just did a wonderful thing, Sharon, with NC Child and a couple of other organizations by publishing Vote for Children in North Carolina. And I'm going to put the link to that in because that's something
Great.
people can share. So congratulations for that. You want to say a little bit about how that happened? Because I love it when we work together. Yeah.
Yeah, we've been talking a lot about wanting folks to think about voting for positive childhoods. You know, when you think about who you want to vote for up and down the ballot, we want to educate the community about the policies, positions of candidates at every level. We talk every single day on the news about what's happening at our presidential level. And we talk a lot in North Carolina right now about the governor's race and the superintendent of public instruction, two positions that have a big impact on policies around kids and families. But in North Carolina, we're electing every member of our state house is up for reelection. We've got a lot of state senators on the ballot. And in North Carolina, we have a state supervised and county administered health and human services system. So who gets elected at the local level for county commissioner really matters. And so we've created a guide together with our partners at NC Child, which is our state's child advocacy organization, the Early Childhood Foundation, and the North Carolina Partnership for Children, collecting a lot of resources about registering to vote, how you do that. Today is National Voter Registration Day, how to make sure that you're still registered where you thought you were registered, because a lot of purging of voter rolls has happened. But more importantly, finding out what your candidates for office think about various policies and asking them, so would you support paid family and medical leave for families if you were elected? Would you support a reinstatement in North Carolina of our state's earned income tax credit? Would you support greater investment in home visiting, parenting education, family resource centers? We want our networks of agencies all across North Carolina, the folks that work there and the folks that are served by them, to be asking those questions of candidates up and down the ballot. Too often, those kinds of questions aren't asked in the big debates. We had a big presidential debate last week, and there was some conversation about childcare around that, but there was nothing about paid leave. There was nothing about other supports for families. There was good conversation about housing. All of those things are interconnected and are part of the ecosystem that supports families and can give parents and kids an opportunity for positive childhoods. So I really encourage all of you to share that. We've been posting it all over social media. Our partners are going to be doing the same thing. When you see it, share it. As many people as possible. Because, you know, when we think about these races, particularly the presidential race, we're thinking so much about other issues and we're not centering families. And one of the things that I think is incredibly important is for us to be telling all of our folks running for office that when we invest in families, that's our best investment. Family is North Carolina's best investment. It's our country's best investment. Because when our families thrive, everything else does too. Because as I said, every single employee at an organization is a member of a family.
That's right. And the more that people can realize that it's the anger and the frustration flow downstream. However, the sense of belonging and feeling valued and wanting to share that could also flow downstream from the workplace. And we love that you mentioned the Early Childhood Foundation. They actually do give out awards to businesses for being family forward. And I know
our agency is Family Forward NC certified as a family-friendly workplace policy agency, because we got to practice what we preach. And it's not hard to do if you really sit down and think about what you can do. I've got two incredible employees that are out on paid family and medical leave right now. We had two gorgeous babies born this summer, and our communications director will be out until January. One of our trainers will be back in October. And if we can do it as a small nonprofit, businesses can do this. There are ways to fill the gaps.
Right. And, you know, we share a passion for the earliest stages of brain development, the first couple of months. And I love that you've given your employees, what do they have? 3 months, 4 months off? 3 months.
3 months.
Off. And so,
and if they have more leave time built up, they can use it.
Right.
And we're giving them the flexibility when they come back to come back part-time if they want or need to.
Right.
And all of our employees also work from home. So they have the flexibility to continue working from home with some support for their babies to possibly still be there. As long as the work gets done,
yeah,
we're okay with it.
great. Yeah, and I know you
Amazing.
shared some materials that I had sent with you
Mhm,
about the first couple of months of
mhm.
life and how vitally important they are to healthy brain development of infants. So I love the emphasis that y'all have on all of that. Sharon, is there anything that you want to say? There was one question about the comment that you made early on about that the absence of positive experiences actually has more of an impact than the negative. And I don't know the source for that, whether it was in Christina Bethel in the study. Was it in the?
It's from the Hope framework, and
Okay.
I'd be happy to. I just don't have it right in front of me. I can give you the citations for that. It's a growing number of studies that are showing that.
Okay. Is that Bob Sege's Hope framework, or is it the Oklahoma?
It's Bob Sege's Hope framework.
We can send that out. We'll send an email to everybody afterwards with a link to the recording, so we can send that out from Hope. Yeah.
Okay.
I also really want to emphasize, Carey, that there are so many good organizations that are doing this work that are partners of ours. We know that this work cannot be done by one organization by itself. Our North Carolina Partnership for Children, Smart Start, is doing incredible work in this area. They're leading work around healthy and resilient communities, and they're doing a lot of work around trying to increase investment in family support programming, evidence-based programs. There are folks at NCPC, or not just NCPC, NC Child is doing great advocacy work, particularly around childcare. A Child Care Services Association is doing great work. Moms Rising does an amazing job in really raising parent voice in the policy process and really helping folks understand what parents are truly experiencing and why these investments are so critical. Our public school forum has an incredible resilience initiative where they've been training our public schools in being trauma informed. There is no one organization that has all the answers, but when we work together and can be working towards some common goals, we can make a really big difference. And when I think about all the things that have happened in the 9 years since I've been at Positive Childhood Alliance, there are days when I get really, really frustrated by how slow the pace of change is, but a lot has changed in the past 9 years and will continue to change based on what the science is telling us. And if we keep putting out there what we want to see and really focusing on that, because when I see it in our child welfare system, we're so focused on foster care and recruiting foster parents that's where the attention is, when what we really need to be doing is making sure kids don't ever enter that system in the first place. And what if we did something really radical, like instead of giving those foster care board rates that we pay every month to strangers to take care of children, knowing that when we separate kids from their parents and their communities, that is an adverse childhood experience. What if we gave that money for a certain period of time to birth families to keep them together and get them stabilized? How much different would our outcomes be? How much less trauma would both parents and kids experience? Those are the kinds of things that we want to be talking about and changing the status quo, because if we keep doing the same things we've always done, we're going to continue to get these really lousy results for kids in our child welfare system.
Right. Well, we're so lucky in North Carolina. We've got people from resiliency communities on this call. Almost every county has some type of resiliency work done. So Sharon, thank you so much. I'm going to turn it over to Allison and she's going to close us out. But what fun this has been. Thank you.
Thank you for having me. This is always fun to talk to both of you.
Absolutely. And I've been loving reading all of the comments in the chat and just realizing how many of us are working on this together, which just makes me feel really hopeful about the future. And so since we're practicing focusing on the positive, I would love to invite all of you, if you're still at your desktop. I know sometimes we put it on and wander around, but for those of you who are sitting at your desk, if you could share something that you feel hopeful about based on what Sharon shared with us today. Put that in the chat. Valerie, you just put a sad face. You're not feeling that hopeful.
I think she was responding to my comment about kinship care.
Oh, I see. Okay. I
I
was
know
like, oh no, there's
that
nothing.
y'all are good at tracking the numbers, Sharon. They have a real absolute data-driven approach to things. And so the 1/3, 1/3, 1/3 program, they will look at what the benefits are of that, and they will get the statistics out about how many more parents are showing up at work on time, how many fewer number of days people are missing work, the healthier people are, the increase in, I'm making this one up, increase in productivity, but businesses love that. And presenteeism, people being truly present at work because they're not worried about their children if they're in high quality childcare. That's a hopeful thought. But you'll get the numbers out on what the benefits are. And that's a wonderful, another great thing that you do is you track the benefits and share the science of it. So thank you.
Well, and I love that there's a science of the positive and that we can grow the positive. We haven't been talking about it that way, but it's possible to grow the positive.
And so to that, to share, because I told people that you had won another big award, and you won from the Montana Institute, where the father of positivity reigns, and that's our dear friend Jeff Linkenbach. What was the award that you won?
We won their inaugural normie, which just cracks me up. They're like the Emmys, and they're so focused on social norms that they call it the normie. We won their inaugural award for organizational transformation for the move from prevent child abuse to positive childhood alliance.
Amazing. Congratulations,
Very cool.
Sharon.
We were so excited.
That's amazing. And of course, love the work that Jeff is doing. There's so many of us. And so, thank you all, each and every one of you, for showing up, being here, participating in the chat. I got so much out of the chat today. Thank you so much, Sharon, for continually sharing all of your wisdom and best practices so that other people can replicate this work. You're not just keeping your secrets, to yourself. You're sharing them. And, this will go up on our YouTube channel, so it'll be available for even more folks to learn from. Thank you so much, Sharon. Carey, thank you so much for hosting this conversation today. You're so good at connecting all the dots and threading things in. So I just always love when you're hosting a great conversation. And then of course you two are the experts in North Carolina. So thank you all so much.